Louisiana's Tuberculosis Patient Advocacy Team presents Trauma-Informed Care, Caring by Understanding, Understanding by Caring, for clinicians and healthcare workers involved in TB.
So what is trauma-informed care? Trauma-informed care understands and considers the ongoing nature of trauma, and strives for environments of healing and recovery. It avoids environments that may inadvertently re-traumatize a patient or healthcare provider. Trauma-informed care aims to shift organizational culture to promote respecting and appropriately responding to the effects of trauma in all people, including staff. Trauma-informed care can become second nature in organizations. It can be practiced in all provider encounters, from front office greetings and data collection, to lab and clinician encounters. The shift to understanding may be seen in our ability to question what has happened to this person in the past. That may now be dictating how this person sees and encounters the world. Have you ever felt put off by someone's comment and you are not sure why? Has a client responded to you angrily without provocation that you are aware of? Have you ever had a patient that could never be on time? Or even that just refused to show up for her appointments? What was your reaction? Were you annoyed? Even angered at the time you felt was wasted? Trauma-informed care means thinking past the moment. What has that patient been through in their life that may have created an aversion to healthcare? A distaste for authority? A fear of trusting? It is impossible for us to know everyone's past. But it is not impossible for us to care.
As public health workers we do care. But sometimes caring doesn't help us enough when we are facing patients that we don't understand. People all have their pasts and presents. Trauma-informed care is about being open to adapting to patients' needs when we are able. Often we don't even know how much trauma someone has gone through or how much we trigger re-traumatization. For example, some people are re-traumatized with a touch on the shoulder, the sound of a voice, or even the health unit itself. We cannot understand it all, but we can always be attentive and purposeful. There are 6 guiding principles that can help us put into practice this approach. Let's go over them briefly.
Safety. Ensuring physical and emotional safety. No physical threats and feeling safe to express thoughts. Common areas are welcoming and privacy is respected. Trustworthiness and transparency. Communicating clearly and often, avoiding surprises, acting with integrity. Respectful and professional boundaries are maintained.
Peer support. Promote environments in which patients can connect with peers and communicate freely. Connect to external resources, groups, online support.
Collaboration and mutuality. Importance is placed on partnering and going through the treatment process together. All staff from administrators to clerks to nurses to housekeeping plays a role.
Empowerment, voice, and choice. Understanding the importance of historical power differentials, in which patients have been diminished in voice and choice and were recipients of coercive treatment. Staff are facilitators of patient recovery and cultivation of self-advocacy skills. This is to be a parallel process as staff need to feel safe, too.
Cultural, historical, and gender issues. Organization actively moves past cultural stereotypes and biases. Recognizes historical trauma and considers current impact on behavior.
Thanks for watching Trauma-Informed Care. If you want more information about trauma-informed care, ask your TB patient advocate and they will get the info you need.